Hi, thanks for coming to Park Avenue LASEK. I wanted to greet you myself just because I do want to thank you for coming in. It is a good first step. A lot of people are, maybe a little anxious. There's no reason to be anxious today because this is really just a free consultation. It's an information session. But I did want to congratulate you. Let's face it, everybody who is currently in glasses or contacts has thought about getting lasered, at least briefly, and you have taken the first step. So I wanted to congratulate you for that. Park Avenue LASEK, in case you didn't know, is the only pure non-cutting center in New York City, and I think it's the #1 center in the country actually in terms of non-cutting procedures performed, which is LASEK, and also national reputation. We are starting to have a national reputation for laser vision correction with the non-cutting method. I have fellows, I've had 20 fellows study underneath me, and they go back to their countries and spread the word. So actually I was quite happy. A couple years ago I was at the biggest meeting in Europe for this type of surgery. It's called ASCRS, ESCRS, and we actually had an ophthalmologist come up to us and try to take a picture with me. I was wondering why, and he said, "Aren't you, Dr. Chynn, the most experienced LASIK surgeon in the world?" And I said, "Yes." I didn't know how she knew that. He was German, but I'm just saying that you want to just come to this center because it's a center, but we're quite proud of the fact that we are, by reputation, the #1 non-cutting center, maybe in the world. What does this mean for you? It really means that we're offering a safer procedure than any cutting procedure. Intuitively, that should be obvious to you. We'll explain why. In today's consultation, you'll be meeting one of my fellows. These are people studying underneath me from other countries. They're going to go back to their countries to do non-cutting. Most of them really are surgeons in their own country and actually LASIK surgeons. They decide to spend 1, 2, 3, or even 4 years studying with me. There are actually only 20 cornea refractive fellowships in the country. This is like every hospital in the United States, every doctor's office. There's only 20 that are certified by the San Francisco Match to train doctors for laser vision correction. So we're proud of that. And you have to understand that the fellows really know a lot. Now, please be a little bit, gentle with them for their English. Their English is always their second or third language. But don't worry if they don't explain things perfectly, because after you see the fellow, who will confirm that you're a good candidate for laser vision correction, then you're going to see me afterwards anyway. The purpose of me doing this introduction is really just to lay out some basics. You'll be seeing the patient coordinator, Jack, who actually lasered 2 years ago. And then he was so happy with his procedure that he recommended his father. We did him, got rid of his reading glasses, which we can do, by the way. And then Jack decided to actually sell his company and start working here. So it's been a good relationship, and that's how Jack came to us. So in terms of road mapping today's visit, we really just want to confirm that you're a good candidate for LASEK. That's LASEK with an E, the non-cutting newer version of LASIK. Many patients who can't get LASIK can get LASEK, like patients with thin corneas, very high prescriptions, irregular astigmatism, dry eyes and night glare, because LASIK unfortunately sometimes makes that worse. I did have LASIK myself. I was the first doctor in the New York tri-state area to have LASIK, and this was back in 1999. And unfortunately, I wound up with some dry eyes and night glare. So after that happened, I decided to switch my practice from LASIK to LASEK. I was one of the doctors who invented the LASEK procedure when I was at Harvard. And since then, really, we've gotten rid of the dry eyes. We've gotten rid of the night glare, and we can laser most of the patients who can't get LASIK. The downside, to be honest, is the recovery is longer. So the patients who come here, and we're doing about 1,000 cases a year, so I've lasered about 25,000 people. I can't go to a multiplex in New York without somebody coming up to me and saying, "Hey, Dr. Chynn, I want to thank you. You lasered me 5 years ago," and it's really nice to hear. So basically, the patients who come here choose a safer procedure that doesn't cause dry eyes, doesn't cause night glare, and actually the final result's slightly sharper than the cutting procedure, but the recovery is longer, and it's twice as long. So instead of a 1 or 2 day recovery for LASIK, which I had, that's the weekend, you don't have to miss any work. Our procedure really is twice as long on the recovery, and it's 3 or 4 days. So you will have to miss 1 or 2 days of work, and we're hoping that you choose the safer procedure with better final results. You're only going to do this once in your life, and you want the best. But if you want a quicker procedure, and I guess if you want a cheaper procedure, and you don't mind some additional risk, then you could get LASIK. I'm not going to say that LASIK's a bad procedure. I had it myself, and I did about 5,000 LASIKs before I decided to switch to the better, more advanced non-cutting LASIK procedure. So I'm not going to say LASIK is a bad procedure. It's just that this is a safer procedure. And I did do a talk at Harvard, continuing medical education, after I graduated from there. We had 100 ophthalmologists in the audience conveniently. I polled them and I said, if you were going to have laser vision correction and you had to choose a procedure, with a show of hands, which procedure would you get? And 95 of them said they would do a surface procedure, either PRK, which is the older surface procedure, which hurts, we don't do that anymore, it could scar, or the newer one, LASEK, versus LASIK. Only 5 out of 100 ophthalmologists from Harvard said that they would do LASIK. I said, why? They said, because it's safer. So if you really go to even a LASIK doctor and you just said to them, look, I don't mind a longer recovery, I don't mind if it's a little tiny bit discomforting, not painful, but maybe a little bit tiny discomfort, like you have an eyelash in your eye for a couple of days, I just want safety, 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 and I don't care about a longer recovery. Do you think a surface procedure would be better for me? They're going to say yes. You know, so if you're going to shop the different centers, you should ask them that. They're going to be honest and say yes. And then you would just have a decision. Do I do the safer procedure and take a couple days off, or the quicker procedure? We can give you a doctor's note, so it comes at a vacation time, a sick time instead of vacation time, so you don't have to worry about that. Anyway, I wanted to welcome you into our practice. I wanted to thank you for coming here, and I really hope that we do make today's visit informative. It's going to take about an hour. We could do it quicker, but the longer you stay, the longer I can answer your questions. And please remind my staff at the end or even during your consultation that you want to save enough time for me. They really like what they're doing, and sometimes they get a little into it, and then they don't leave enough time for you at the end. So I would just appreciate you reminding my staff. I want to see Dr. Chynn and talk to him at the end, and I will do that. I really want to meet with all of my patients beforehand. If I'm not in the office today, I do a lot of traveling and lecturing around the world. I've been to 75 countries. We will set up a text group. You can text me. We'll do it by WhatsApp. You can even call me when I'm abroad. And you know, then if you want to meet me before your procedure, which is normal, we could set up a second consultation. So I wanted you to relax, just enjoy the process. It's an informative thing. Hopefully you learn a lot, and I'm hoping that you're comfortable enough to do the non-cutting LASIK procedure after today's consultation and finally get to be eyeglass and contact lens free and have the clear vision for the rest of your life that you really want, you deserve, for you to enjoy for the rest of your life. Thank you very much for coming, and thank you very much from Park Avenue LASEK.